November 1st and ends January 31st, 2017. Steve Bosch, KUSI News.
All right, thank you very much for that, Steve. By the way, I've got to go check my mailbox because I fall in among the millions who have health insurance through Covered California. But on the same note, here to talk more about what to do if you are covered under a health insurance plan with Covered California. We want to introduce you to Craig Gussin. He is agent and vice president of media for the San Diego Association of Health Underwriters. Craig is here to help. Thank you so much for being here. It's such a confusing and complicated thing that some of us have to deal with year after year since this took effect. So where do we start? What's your best advice? Where do we start in terms of assessing our health insurance plan?
The best thing to do is look at what you have today. Has it worked for you last year or this year? What do you have planned for next year? Are you having a procedure? Are you having a surgery? Are you having anything different next year that you had this year? We can't foresee some accident happening, but let's just look in the last couple of years. If you like your plan and the costs aren't going up that much, maybe stay where you're at. But if you're with either Blue Cross or Blue Shield, they're having the biggest rate increase. So you may want to look at some other options, such as Sharp, such as Kaiser, and that might lower your cost and give you the same plan, or maybe even get a better plan for a couple of dollars more.
That's interesting. Yeah, I mean, you're in the know. You've studied this. You talk about this with your clients. You said Blue Cross and Blue Shield is having the highest rate increase. Right. So if you have a plan with them, you may want to consider and just shop around. Just shop around at least.
And the big key is, are you willing to change your doctor? Because if you have a Blue Shield individual plan, you're going to be in the Scripps network today. So you have a choice. You could stay with Blue Shield, take the rate increase. You could go to HealthNet. They have an HMO plan that uses the full Scripps network, so you can stay with your doctor. Or maybe you save more money and go to Sharp for a year and try it, or Kaiser. You know, I always tell my clients, maybe try it. Try it for a year. If you don't like it, we can move you back next year at this time. Because it's only a 1 year plan. So that's a way of lowering cost.
Now, to be fair, Blue Cross and Blue Shield, not the only health insurance, obviously, that's going up. We're talking Sharp, Kaiser, also going up, not as much. Right. HealthNet as well, and it goes on and on. Right.
There's also a company out there called Molina. They are new in town. They have probably the lowest rates out there. However, the network is small of doctors. That's why it's going to be least expensive. So you really want to work with your agent and go through it and figure out which plan is going to work best for you, because this is what we do all day long. And if you know, we get paid by the insurance companies, even though we're working for you, and we can educate you, help you, give you ideas, figure out what's best for you, because most people spend all their time doing their job and dealing with their families and everything else. We can sit down in 10, 15 minutes, give you a good education of what you need to do to find the best plan for you next year, for you, your family, and just give you a good analyzation of that.
And I know one of the things that Steve Bosch pointed out was, you know, you've got the bronze plan, you've got the silver plans, and then you've got the gold plans. The bronze is typically less premium, but chances are you're paying more out of pocket.
You've got to be very careful with the bronze plan, because you get 3 doctor visits for $70. Everything else is a $5,000 deductible. If you're taking a brand new prescription, there's a $500 deductible per month per prescription. So I don't like the bronze plan. That is basically for somebody who says, if I just need catastrophic coverage, if I got to come up with 10 grand out of pocket, I can do that. And the reason I say that is because the maximum out of pocket per person is about $6,800, as Steve mentioned a couple minutes ago. I don't like the bronze plan for that reason. I like the silver plan. You're going to have $40 doctor visits, $45 doctor visits, unlimited doctor visits. Your deductible is only about $2,000. The gold plan has no deductible. Your doctor visits are $30.
But it's more out of pocket.
But it's more out of pocket.
In terms of premium.
If you're going to have a procedure done in 2017, you're better off with a gold plan, because you're paying a little more money per month now to pay a lot less then. If you're going with a silver plan, is the most popular plan that everybody buys. because it only has a $2,000 deductible. All of them understand that once you hit your deductible, you're going to pay a percentage of somewhere between 20 to 30% out of pocket until you hit your maximum out of pocket, which is somewhere around $6,500 to $6,800. But the average person will only spend somewhere between $800 to $1,000 in a year. And if it's all on doctor visits and prescriptions, the silver plan works fine, where the bronze plan, unless you have those kind of assets to fall back on, you don't want a bronze plan. Unless you never go to the doctor, then it's a fine plan.
Well, thank you so much, Craig, for
My
putting
pleasure.
this all into perspective, and that's great advice. If you know you're having a procedure, if you're
Yeah.
pregnant, perhaps, you know, you're going to have that baby next year, you may want to just consider other plans, see,
Yeah.
you know, and compare, and call your agent at the end of the day, because that's what you do. is
Exactly.
You help us sort this thing out.
And it costs nothing to use us.
Thank you very much,
My pleasure.
Craig. Nice to see you.
Good to see you.
All right, the San Diego Gulls kick off their second season tomorrow.